So let's begin.
Wonderful.
I'm Sarah Kennedy from Colorado Hands and Voices. I'm also a mom of a 21-year-old and want to thank Sandy Gabbard at the Marion Down Center and our audiology training for now graduates and JFK partners putting on Tuesday for us every Tuesday in May. So this is our last session on equipment TLC and troubleshooting. And also anyone can bring questions today, open mic questions. So Sandy, do you want to introduce yourself?
Yes, I am Sandy Gabbard. I'm an audiologist. I'm at the Marion Down Center and I'm at JFK Partners with the LEND program. And LEND stands for Leadership Education and Neurodevelopmental Disabilities. It is to train practitioners who work with individuals that have various types of challenges. And today we have two of our almost done, this is actually their last hurrah, LEND trainees. They are audiologists. They are about to go into practice themselves, and they have been hosting this month's Tech Tuesday. And is Cassie on? I don't see her, so I will introduce Annalise. Annalise is going to lead the discussion today.
Hi, everyone. Also, Cassie's just having some technical issues, but she'll hopefully be on soon. But my name is Annalise. I'm the 4th year fellow here at the Marion Down Center, just kind of finishing up my time. But this topic here for this week, equipment TLC and some troubleshooting at home, and we'll just kind of jump into it. I want to make sure that there's definitely time for questions and anything that anyone might bring to kind of the open mic portion. Can you all see my screen okay? Is that fine? Okay, perfect. Okay, so just my first sort of question for everyone, feel free to shout out. What type of tools do you have at home to take care of your devices? If anyone could just kind of ring in about the different things maybe that they use or have.
We have a dry box.
Okay. Anybody else? Have you had any maybe experiences with using little sticks like wax traps or anything like that? Yeah. Okay, well, we'll kind of get into the different pieces of things that we have here today. I know that some of this can be a little bit difficult to kind of put into words or just show pictures of. So we do have links too at the end of this for basic care that we'll make sure to send out. And there's videos and things there that kind of can walk you guys through these things to help with that. So we'll just kind of start first with just some troubleshooting and basic cleaning in regards to being at home. So just kind of the first thing in general, if we're ever having issues with our devices, we just kind of want to do a visual inspection. Make sure you know that maybe there's nothing that's cracked or seems clogged up or maybe just doesn't look right at all. And one of those things, especially in regards for hearing aids, can be when it comes to cleaning and brushing over mics. A lot of times either your audiologist can give to you or it comes in the little pack, a little brush. I have some pictures here that show where the little microphones kind of lay on the hearing aids, which can help you in kind of finding where you should be going over things just to kind of clean things up. But I always say that's kind of our first step to see what the issue might be. The next kind of big thing I feel like that people sometimes have issues with, or something that could be fixed at home, is clogged wax traps or tubing. So just kind of what a wax trap is first. It's this little white thing. There's a picture at the top of the screen that is on the end of the receiver and usually kind of sits under either the dome or maybe the mold of the hearing aid. My metaphor that I always use with those is it kind of works like your kitchen sink, except what it's doing is it's catching all the wax and keeping it from going within the hearing aid. So sometimes when those are all clogged up, we don't get any sound out, where it may seem like our device is actually not working. So there's usually little packs of sticks that come either from your audiologist or in your pack, and you can use those to switch out an old one for a new one, and a lot of times that can kind of be the trick. When it comes to tubing, so if maybe you don't have a RIC hearing aid like we talked about last week, but something more traditional, BTE, behind the ear, If there's earwax or fluid, sometimes our kids can suffer with a lot of ear infections. Sometimes that can kind of clog up the tubing, and that can cause an issue as well, so that sound is not getting through as well. There's these fun little blowers that you can find usually at Walgreens or something like that, and if you detach your ear mold from the hearing aid, you can usually try that, and sometimes that clears up the issue to kind of help things through. The next thing, kind of relating to that, is I'm sure that a lot of you had tubing changes back in the day. That was the big thing, but I know especially with everything going on with COVID right now, trying to make as much possible at home for you all is kind of important. So home tubing is definitely a possibility. So just things on when you would change it, usually if there's a tear or rip in the tubing, so that might be creating some sort of feedback. When it's hardened and it can be uncomfortable, if it becomes too tight or too loose, or if your children know that maybe there's a change in their sound quality that they're getting. But the supplies you need is actually not too much. So you would need the actual tubing pieces, usually you can get from your audiologist, some scissors, and in some cases, maybe a reaver if you get some tubing kind of stuck in that ear mold, but that's not usually many cases. There's a link for the video kind of on the bottom, which puts you through the steps completely. I have some photos here that kind of trace the outlines too, where you're gonna take the tubing, sort of push it through till you get about a 90-degree angle, then you'll work on fitting it to your child. So kind of here are the basic changes for ear mold steps here, and then a guide for kind of how to cut it. I know this is a little bit difficult to kind of explain in words, but there are videos there and they're incredibly helpful in kind of how to do this yourself. Next big issue I know that we kind of see a lot of times happening is feedback. I'm sure you've all experienced that once or twice. A lot of that can come from either the way the ear mold or the dome is kind of placed in the ear. Maybe they've outgrown it. Maybe it's ripped or it's broken. There could be some wax. Maybe their tubing is ripped. So really making sure that there is proper fitting ear molds, that kind of everything is in place first, maybe before going to your audiologist, and having any sort of programming changes is kind of the way to go first. Next big thing that we see sometimes with kids is moisture. Usually it's not as big of an issue out here in Colorado. I came from Texas where dry aid boxes were what everybody swore by because it was so incredibly humid. But y'all don't really have that issue as much here. But those are still really important things. Either putting your hearing aids or your implants in them at night, just kind of keep everything up to date and fresh, which I would say isn't a bad thing at all. And then I just have a question for you all. I kind of covered some basics here first, but what are the top problems that you face with your child's technology? Whether it's kind of like basic TLC, troubleshooting, what are those things that you kind of feel like you have a hard time with sometimes?
I think for us, when we switched to the slim tubes or thin tubes, whatever you call it, it was shocking how tiny a piece of wax could impact. And we had, I guess we didn't have the little puffer blower thing, but we had like a, I don't know, it almost looks like fishing line, but it's more robust. And so we would take that apart and then be able to do that, you know, and finding that source. And of course now we just had a situation, well, last week actually, because we have the newer Phonax where one of them stopped charging. And so we were able to reach out and of course remotely, but it turns out there's a hard reset. But I think sometimes too, it's that, well, it's worked with this battery and it's worked with that battery. Like in the olden days, sometimes you get a whole bad pack of batteries from Costco. Thankfully they take it back. But, you know, for us, those kind of seemed to the main things is finding where in the world that little piece of wax was. Or, by the way, the hearing aid's clean, the wax is in the ear causing the problem. So those were our primary things. And I'm sorry, this is Brenda Elliott.
Thank you for sharing, Brenda. Anybody else?
Kelly. We get a lot of condensation in the tubing. My son's really waxy as well, but we do get a lot of condensation in the tubing.
Do Do you all have a blower or anything like that? Okay, cool, great.
Yeah.
We had a lot of that when my oldest, this is Brenda again, was in marching band. And we even, yeah, we had just a lot of issues. At one point we tried some different covers for them, although more water resistant than they used to be. But yeah, I think that's common, especially in the summer. The other thing sometimes is with the equipment at school, you know, was it the receiver or was it the aid?
Trying to figure that out. It's definitely a thing. Thank you. Anybody else kind of before we go to the next part?
Brenda, now that you brought it up, the water resistancy of behind the ear hearing aids today, the hard case part is actually quite water resistant, even almost waterproof. So usually the problem is in the tubing, the slim tube, the receiver, as opposed to the hearing aid itself. And you can actually drop a hearing aid in water, newer hearing aids, but the microphones might plug up. So you might have to brush out the microphones. They might plug up with water. But the hearing aid itself is usually pretty stable when it gets moisture.
Good to know. I've heard that, but I think we've all been brainwashed for so long. But yeah, and this was back, well, that one graduated in 2014, so he had more of those moisture issues before it was, but that's good to know. And what a great gift, because how many times are your kids playing outside and somebody wants to get into a water fight, and before you realize it, you know, your kid's like, Mom, you know, my hearing aid got wet. And so I'll share that information with my kids and the families.
Being splashed is fine for almost any hearing aid purchased in the last 5 years or so. Again, it might temporarily plug up the microphone, but no worries.
Our hard thing has been with, this is Jamie, our hard thing has been with waterproofing gear and the coils going bad from pulling the coils in and out from the waterproofing gear.
Yeah.
And with the kids being in and out of the pool summer long, you know, we're trying to figure that out. We let him go in one time without it. And we got the dreaded white solid light on his implants and had to send them back. And then we got the big lecture about not putting them in the dry box every night, even though we do live in Colorado. So they religiously now go in the dry box every single night.
Thank you all for sharing. Just kind of then sort of the next part in this, I know that sometimes we can't necessarily fix everything at home when we might be having an issue. So just kind of some things when we might need audiology could be either like a firmware or software update, something within the technology itself. If you have a cracked or broken case or ear mold, something you know that's not going to get you by, some sort of internal issue that can be fixed by the things that we sort of discussed, maybe inconsistent amplification if it's not, you know, doing the job all the time like it should be doing, and if it's kind of going in and out. If there's any change in hearing that you feel like your child might be experiencing, and of course any ear pain or dizziness. The last sort of topic I was just going to talk about and hint on was actually in regards to things being waterproof. We know that things are much more water resistant, like Sandy said, which has been a great thing. Of course, I mean, we probably still don't necessarily want to shower or go diving, things like that with them, because, you know, it can only go so far. But like Sandy was saying too, the wire, the little receiver, the microphone, those are kind of the most vulnerable parts of the hearing aid. And whether it comes to a little bit of cleaning or something that can be done in the office, usually those things can be fixed. For cochlear implants, I know Jamie, you kind of hinted at this some, you know, there are specific waterproof cases that they're definitely working on for devices, which is great. They've come a long way, at least in regards to that. I know they are not perfect. They're kind of trying to figure out how to work out those kinks when it comes to those things, but hopefully they'll continue to do that. Here is just a link, and we'll kind of have it put up. It's through our YouTube, and these are all video assistants in regards to basic care. Another one of our audiology fellows, Liz Pankos from Denver Health, actually put these together. So it'll actually show you in real life time, you know, how to change your tubing, how to change your wax trap, like different things like that, or if you have issues with feedback, just so they can kind of help you versus words, but seeing a visual for it.
Annalise, let me just add, if people are watching this, not in real time, not on the day we, that's a temporary link. And they will be posted both on the Marion Downs YouTube site and on the JFK site. But right now, that's just a temporary link. But if you're looking for it in the future, you can search the Marion Downs channel or search the JFK website.
Perfect. Thank you, Sandy. I didn't know all of that. I'm sorry I went a little quick. I know it wasn't as much kind of interaction this time, but I know we've kind of been running over consistently. And I want to be respectful of all of your time in regards to having, you know, open mic, any questions that you all might have and how we can help you. So is there anyone that's in need of anything?
This is Sarah. We did have a question after the last class
Okay.
regarding when you send in hearing aids for a warranty check, like if you know your insurance is going to end. Was there something equivalent for cochlear implants? I am not positive myself, so asking you guys.
I'm kind of thinking off the top of my head. I'm not 100% positive about that. I know in it regards to cochlear implants, we have to be a little more careful with the specific warranties with different parts of the device, you know, where your warranty for your actual processor is like much better than what it is in regards to the batteries and things like that. So I think one, just keeping in mind where each of those are is a good thing. I think sometimes it's a little bit different with CIs because, you know, if something is broken or if something isn't working or anything like that and you give it to us, when we send it in, they usually send something back brand new pretty quickly. So it's a little bit different. I can't think of anything off the top of my head in regards to kind of a clean and check. But I think, of course, if you feel like there's any sort of issues or anything, we usually contact the rep and they usually tell us what the best route is for that.
Yeah, and I think a regular mapping would show any deficiencies in the processor itself.
Yeah,
So
when you
that's
look at
what I thought.
impedances and things like that too.
Right. And then I just wondered if you want to share the importance of doing regular ling sounds with kids so that you know what their responses are when we get into wondering if the hearing aid's working as well as it should, not just the on or off, but quality.
Yes, no, that's a really good thing to bring up too, which I kind of started with this in regards to my cochlear implant patients, but then I've kind of just put this across the board for all patients in general. But what Sarah brings up, the 6 ling sounds are ah, oo, e, s, sh, and m. And so what that is that essentially covers the whole speech spectrum in regards to what we're hearing and for, you know, English speech and language. So in practicing those with your kids or making sure that, you know, the hearing aid is working up to date, like if you know it's working well, I would say, you know, practicing those, seeing what they are getting or not getting and sort of keeping track of those. If you try either, first, I usually give cues so they kind of know what's going on. So giving the sound so that everyone can see for visuals. And then usually covering your mouth and seeing how well they do then can also give you a better regards and to how, you know, what they're hearing across the spectrum. Sandy, has anything she wants to add either?
I think it's important to recognize that doing the ling sounds is not just for little kids. I even do it with a lot of my adult patients. And the expectation is slightly different for hearing aids and cochlear implants because sometimes with high frequency hearing loss and hearing aids, sometimes kids cannot hear the sounds distinctly, even in best aided condition. The expectation for cochlear implants is that the cochlear implant is providing audibility across the pitch range. So kids with cochlear implants should have audibility for all of the sounds. But keep in mind that there's probably a baseline. In other words, what your child knows how to do versus what they're learning how to do. And as Sarah said, when you know your child can do it, it's a real quick check to make sure everything is still audible. Once they're learning how to do it, it's more an auditory training exercise, which is good to do. And in our preschool, we do it every day with all the kids all the time because we want them to get proficient. And so the idea then you could do a really quick ling sound check whenever you're concerned about their audibility or their ability to hear those sounds.
This is Brenda. I was thinking too that I know when our kiddos were young and had, you know, batteries on their hearing aids and stuff, that sometimes and back in that day, you know, we would take the hearing aids off during the nap. I don't know what the current philosophy is, but we didn't want them playing once they woke up and finding a lovely hearing aid to put in their mouth. But, you know, we would check like after nap, but then the battery had a little time to rest, and then it might die later on. So, you know, we'd always check it like first thing in the morning, you know, before we knew a little bit better. But we started instituting sort of like a mid-morning check, and then like a, you know, an hour after nap or something, because, you know, that pre-language, they don't know when their hearing goes, like, as one of my kids said, dark, or the battery is starting to die. So that was something that we learned for checking those. But yeah, those links full. The other thing I wanted to say in terms of how audiologists benefit us is occasionally I'll have Earmold for a while and it's been great, and then all of a sudden he'll get a sore in his ear, and it's not that he needs a new mold, it's just something has changed. So our audiologist has been able to use a little tool to just kind of make an adjustment to that ear mold in the place where it was bothering him, and then off we go our merry way. So that's been very helpful too, so that we didn't have that expense of having a new mold, because it doesn't usually happen in the first 30 days, at least not for our family.
And Brenda, that's a really good point. And audiologists do use all kinds of things, Dremel drills. We have a buffer system to just take a layer off wherever it might be a little bit tight, to keep from having to remake the ear mold all the time. How many of you feel comfortable changing tubing? How many of you that have ear molds? Because I think that's a dynamic shift that we've been seeing during this time of stay at home more, is I think more audiologists are comfortable encouraging families to change tubing. So it might be something new for a lot of families. So I don't know if anybody has any questions, concerns, or even comments about some of the experiences they've had.
I always let my husband do that because he has better eyes, and he did a great job. And now that we have the receiver and canal, I don't think we have that option, because I think it's just like certain sizes. So when that goes south, then we have to reach out to the audiologist and get that replaced.
You do, however, if there's a time where it's really difficult for you to go, you could request to be given an extra receiver and be shown how to do it. There's a little tool, but it's something that is possible to do at home, just something that we don't commonly send home.
Only when we have the pandemic, you know.
That's right. A pandemic, or, you know, if somebody's going around the world, or, you know, on a long cruise, sometimes we'll give them a backup, but.
Great. All right, thanks.
I have a question. This is Renee. Is there I thought I heard somewhere regarding disposables and rechargeable batteries that one is better than the other, because when it starts to die, it'll just shut off the diminishing quality of it. Is that still true, or is that like if you have disposable, I can't remember which it was, but if you have disposable versus a rechargeable, one of them, when it hits a certain level of power, it'll naturally just shut off. Versus if it's just getting low, then there's a diminishing sound quality.
Actually, both rechargeable and regular batteries should shut down the hearing aid when they get low, as opposed to just decrease the audibility or decrease the power. So the hearing aid or the cochlear implant is set to not be able to respond once the battery power gets low enough that it would compromise the signal.
Okay.
Now, what you may be thinking is sometimes rechargeable batteries, especially the kind that you have to put in the device, they typically do not last as long, so they're more likely to go dead faster. And of course, the newer rechargeables in hearing aids, and the ones that are now recommended, are the ones that are built into the hearing aid case. So you're not actually even touching the rechargeable battery any longer.
Okay, thank you.
I know for my 12-year-old, when he went from the disposable batteries, that they would just die kind of without warning. He didn't really have much notice. So we just kept those disposable batteries with him now. And since December, he's been with the aids that he recharges every night, much longer. And it's, like I said, it's kind of more of a gradual, it's not like a sudden loss. He kind of gets some warning and then he can put it on the charger, and it doesn't take long at all for it to charge. You can put it on the charger for a few minutes and it'll last for several hours. So he's been pretty pleased with that.
Yeah, that's good feedback. And I think it is true that the older devices didn't give you as much notice either for regular batteries or rechargeables. And I think the newer ones give you more notice, and more notice might only be half an hour. It's not that they give you a couple hours to get home from somewhere, but at least they do give you more than 5 minutes usually.
Right. Yeah. Just right. As the teacher's talking, he didn't want to go and, be disruptive and say, "Excuse me, I need a new battery."
I have a quick question regarding like mic covers on the CIs. So what happens, and we're going to go see our audiologist next week, so it's not a big deal, but they've got the little push tab that's like sticky almost to get the old mic cover out.
Okay.
What happens if it gets stuck in there and you can't get it out?
Do you have cochlear or advanced bionics?
Cochlear.
Cochlear.
Can I use tweezers? I want to damage it.
I mean, I'm not going to lie to you. I have used tweezers in regards to some of those things because I think with cochlear implants, they are just so small, like especially those little mic covers and things that, I mean, sometimes you do have to use what you have to use to get it off. I would say, we have to try and be very careful just because like of where the microphone in it is,
right.
Being a little more gentle and making sure that, we're not going to pierce anything or kind of hurt anything in that regards. But I would say, no, you can definitely do that. I think with mic covers in regards to CIs, usually I think they get changed out kind of at like your normal mapping appointment. So, usually people don't have as many issues kind of in regards to that because it's kind of on a schedule, something that usually your CI audiologist just kind of does to freshen things up. But yeah, no, I would have no issues in regards to you using that. We have lots of very small tweezers that get busted out for things at times. So
okay, thank you.
You're welcome.
The audiologist toolbox that you guys don't always see has a lot of little things that you might equate with like making jewelry or, little tweezers, little tiny things that push things in, very, pointed little needle nose pliers, little cutters that are made for very small things. So some of those kinds of tools you may have around and you could improvise a little bit. Great. If we don't have any other questions, anybody want to bring up another topic? Or maybe we'll actually finish on time.
It'll be the first week. It doesn't look like there are any other questions. Well, this has been a great series, and I know we're planning on posting these with captions after the fact, and so people can watch these later, and that'll be a great resource.
Yes, we will have all of these posted both on the Marion Downs YouTube page and at the JFK website, JFK Partners, which is at the School of Medicine. We're working on them right now, so hopefully within a couple weeks, and I will let Sarah know so she can post it on Facebook once they're up.
Will do. Well, thank you again, everybody, and this has been a terrific series.
It has. Thank you.
And best of luck to our new audiologist as well. Are you staying in Colorado, I hope?
My plan is yes. hopefully, fingers crossed, if things keep going well, I accepted a job actually at Cherry Creek School District to be the
Okay.
new educational audiologist. So if any of you are down there, maybe I'll see you.
Yeah.
And
Great.
we have a new group of audiology LEND trainees, as well as other types of trainees starting between June and July. And the audiology LEND trainees include 4th years, and we have a couple, some 3rd year AUD students at CU as well. And so look for them to be doing some projects. So if you have any requests, we would love to support the Hands and Voices community as much as we can.
Thank you so much.
All right. Over and out, everybody. Nice seeing you.
Thank
Bye-bye.
you.